All right, hello everybody. Today we're very excited to have Katie Whipple and Laurie Peebles, who are two very experienced music therapists and music therapy professors, with us to share some strategies that we can use in our music classroom. All right, which one of you are starting?
Go for it, Laurie.
All right. So hi everyone, I'm Laurie. I have 11 years of experience as a music therapist, working primarily in private practice with children of all different exceptionalities, primarily autism and behavioral disorders. But also I have experience working with children who have experienced trauma. And then I've also worked in the medical setting and also saw patients with varying diagnoses and behavioral disorders as well. So I am not new to music education. I did my music therapy internship in the Fulton County Public School System, working to make accommodations within the classroom. And my master's degree is actually in music education. Specifically, my thesis looked at making accommodations in a general music classroom with a general music teacher and a second grade student. My primary instrument is flute. So hello, bands, people out there. And I also love singing in my church choir.
Thank you, Laurie. Hello, everybody. I'm Katie Whipple. I am currently the undergraduate coordinator for our music therapy program here at Georgia College. I've been a music therapist for 16 years now, and I've been teaching at Georgia College for 9. My primary instrument is classical guitar, but most days I don't get to play classical guitar. I'm mainly playing things that my clients like to hear. And right now, we have a really large contract with our local school system through the music therapy clinic. We established that contract back in 2016 is when I started that program in our local school system here in Milledgeville, Georgia. And we serve at its height, we had about 80 students that we saw with disabilities every week in a self-contained setting. Since COVID's happened, the numbers have been a little bit less, but we're continuing to build that back up. So a lot of my experience in working with children specifically have been in that school setting, primarily in a self-contained classroom, all the way from kindergartners all the way into high school. So really serving that whole gambit there. I also like to sing and I also like to play drum set. And I also like to explore technology and figure out ways in which we can use technology to make music with people. So today's agenda, we wanted to sort of just talk about some common issues that music educators are sort of experiencing when it comes to serving students with disabilities in that music classroom, and just some general kind of overall strategies that we can think about. And then we'll move into talking more about specific student needs. So looking at some of the students that you may have experienced teaching, what some of the behaviors might have been, and really some specific strategies to help support them. Then we'll present a couple of case scenarios to try to apply some of this information and some of these strategies. So given a certain student and their abilities and needs, what could we do as a music educator to make them successful or help them be successful in that classroom? And then we'll wrap it up with just some additional resources. So we do want to thank you for joining us today. And hopefully you will get some good information out of here. We do want to encourage you to reach out to us if you have any questions after you view the presentation. We would be glad to consult with you or just offer some assistance. Before we get started, we did want to kind of just briefly mention what is music therapy, not knowing everybody's experience with music therapy. There's a lot of misconceptions around what it is, but essentially in a nutshell, we're intentionally using music to try to achieve typically non-musical outcomes, which is different than music education, right? Music education, we are working on those musical abilities. But for a music therapy setting, we're looking at a lot of the other skills that a person might have. It's also based in clinical, and really our clinical experiences. What can we learn from other professional music therapists? But also, what does the evidence say? When we say evidence, we're talking about research. What does the research say about how we use music to support individuals? We're trained in a lot of different areas. So we have a primary instrument that we study, but we also have to become proficient in singing, playing piano, playing guitar, and then other little instruments, recorder, accordion, ukulele, steel drum, all kinds of instruments that we might bring in. We also get a good amount of information and training in psychology, even anatomy, and of course, research methods in music therapy. So there's a lot that goes into that training to really understand what's going on with this person and how we can help them. We also serve individuals throughout the lifespan. There are a lot of music therapists working in school settings and working with children in general, but on the other half of that spectrum, we do have a lot of music therapists that are working with older adults, middle-aged adults, and even expecting mothers or bereaving families. So we really kind of work with people all throughout the lifespan, which again is sort of different than music education, where we're really working in that K through 12 or maybe pre-K area. So it's just a little bit different. So some common issues, and this comes from Darrow, a publication by Darrow, looking at what were some of the issues that music educators were, I guess, experiencing in their work, trying to work with students who might need just a little bit more support. One of the issues was just being able to collaborate. Having the time to collaborate with other professionals was a common issue. Just getting information about students, what their disability might be, even having access to the IEP that they would have. So just getting access to information and probably having time to getting access to that information. Trying to develop ways and ideas to adapt either the curriculum or maybe the instruments or the music itself, figuring out what's going to be the best way to adapt these aspects for a student was also a common issue. And then thinking about placements of students within that music classroom, physically, where are they going to be placed and what kind of supports might they need around them to be successful. Sometimes there was a struggle with trying to help the students socialize with other students in the classroom. So really trying to get that full sense of integration with a student with disabilities and then those without, making sure that they were having that meaningful socialization and how to help with that. And then just time, just not having enough time, right? Because you are stretched. And so having time to be able to do the necessary, I guess, prep work to try to help that student be a little more successful. So as we go through this, I really invite you to think about all of, the various issues that you might have had in your teaching when you're trying to support a really wide variety of students. So one of the first steps, and this comes from a really excellent book that I want to introduce to you. Hopefully you can see this here, don't know. But it's called Music and Special Education. And it really takes a nice approach and provides a lot of great information for not just music therapists, but also music educators. And one of the first pieces of advice that they get is to really try to gather information. So going to IEP meetings is not going to be realistic with your workload and everything else that you are doing. But just gathering some basic information can be helpful. And so you could get this information from consulting the IEP. You should have access to that if you are part of that student support. You can also check in with the teacher, their primary teacher, but also the paraprofessionals. They can be a huge source of help. And so Adamek, I'm not sure if I'm pronouncing her name right or his name right, but Adamek and Darrow have this really great one-sheeter that you could use to sort of help guide a little bit of thinking. So it's very streamlined. Basically, what are the student's strengths and special skills? What disabilities or limitations or needs they might have, some relevant IEP objectives so you can have an understanding of, what is it that they're actually working on, because that's usually an indicator of what's most important for that student, and then useful strategies. And so the next slide will really kind of give you an example of this kind of in play. And so it's not a whole lot of information. And if you don't have the time to do this, you really could consider advocating to administration, hey, when I have students with disabilities, can we have these teachers, these inclusion teachers, or whatever their primary teacher is this something that they can provide, not just to me as the music educator, but also the art teacher, the PE teacher, because they're going to be going to all of these other exploratory or fine arts classes. This could be helpful for all of these teachers. So they could make one document and then make it accessible and easy for all of us. So that could just be something that you advocate in your own school if necessary, so that you can have straightforward information about how to help that very individualized student.
Excuse me, Ms. Whipple.
Yes.
Back up. Our music teachers are very definitely expected and required in IEP meetings, RTI meetings, 504 and the like. So they should be able to do this during those meetings.
Oh, well, that's wonderful. I'm glad they have time for it, to be honest, Tina.
They don't have a choice.
Okay. Well,
That's actually really good to hear, because in South Carolina, I know that a lot of the music educators that reached out to me for help, they were encouraged to attend, but the meetings often occurred during their classes and they couldn't attend. So I'm really glad to hear that it's a requirement in Georgia.
Yeah, a lot of times you have to get somebody to cover your class because you may actually be the only or one of the only general education teachers, and you do have to have a general education teacher for an R, for a, sorry, IEP meeting. They can't just be the special ed teachers.
Excellent. Well, this would be a good thing to kind of put together to help you sort of minimize, because those IEPs are pretty extensive and this can kind of help streamline that. Wonderful. All right. So another tip that's provided, and probably many of you are doing this already, but if you're not, it would definitely be helpful to make sure you're developing a really explicit course description about your courses. Make it really clear what's required for that successful participation in your classroom, so that when you do need to go to administration, possibly, you can say, this is something that we really need for the support. So we really need for this peer to be able to assist the student. And be able to get a little extra support in your classroom. So listing things like any kind of prerequisite courses or skills, of course, the class size, any skills that just might be needed to successfully participate, such as good listening skills or the ability to read, any kind of required homework or performances. And then really, I think the most important is the amount and type of assistance that is needed. So this can just kind of help make it very clear what it is that students need to be successful. So if a student is going to be in your class who maybe doesn't have all of these skills, then you can really advocate to have extra support for you. This information here is really just some general information for adaptations in the classroom. And so I'm not going to go very in depth with it at the moment. I do want to just briefly go over it, but there's two ways that we could think about adapting our music classroom. Of course, the first is instruction. And with instruction, we have this whole gambit of all the way from participation down to level of support. So in other words, how do we adapt our instructional strategies and our curriculum to try to help the students be more successful in our classroom, but then also some ways that we can sort of adapt the environment to help make them successful. So this information has been adapted from, again, the same text I was referring to earlier, Music and Special Education, but I think it's nice because it helps us to organize our thinking around, okay, what is it that the student needs, and what part of how I'm providing my instruction and setting up this environment, what exactly can I do? It can help really kind of guide your thinking. So we can either adapt participation, how much we are expecting them to be able to participate and attend and be in that class, considering if they are getting overstimulated or not. It might also be just adapting the way that we are providing instruction, so that input, and making sure that we're using that multimodal approach where we're providing a lot of different ways for our students to experience things. The teacher might, for example, use visual aids, require a little more active participation, or just provide lots of repetition and consistency. And we'll talk about visual aids here in a little bit. It might be output, just adapting the way that you're expecting a student to respond. So you might have a student who might just respond through movement. So maybe they can't tell you that they can do something verbally, but they can demonstrate it. We'll talk about the use of AAC devices in just a little bit here, but that's also another way that a student could respond and kind of change that output. Of course, we can change the difficulty. We can change the level of skill or difficulty that's required. We might simplify instrumentation or a voice part. There's a lot of things in which we can do with that we'll discuss today. Time, just adapting the amount of time a student has to complete a task or essentially learn a new skill could be something. And the teacher might collaborate with other teachers to try to say, okay, well, during their study hour, they need a little more time working on this, this concept that we're teaching. Can he work on this during that study time, and try to do a little collaboration in that way. You might alter the size, so just adapting how much material the student is expected to learn. Modifying questions if you're using music worksheets, or you might just modify rhythms, how many they're expected to learn. So if everybody else in the class is learning several different rhythms, maybe this one student is just trying to learn that one. You might be providing alternate goals, so adapting the outcome expectations or goals. So teachers might develop something that's just a little bit more appropriate. And we'll give an example later of a case scenario where we have a student whose goal might be adapted just a little bit differently according to their needs. Substituting curriculum is another way in which we might adapt our strategies and curriculum, providing different ways to meet those needs. So they might essentially just benefit from having a music therapist in that inclusive classroom with them, or some type of music consultant to come in. So what can we do to kind of help supplement that? and then level of support. So seeking additional assistance from the speech therapist, the OT, the PT when needed, or even recruiting peer tutors. When we're thinking about peer tutors, though, you really want to, it's not just a simple matter of, I'm going to pair this really attentive model student with this one student. I mean, we need to make sure, I mean, it could even be contraindicated for gifted students because they are expecting so much things to be a certain way, then it might be hard for them to work with someone who perhaps has a disability and just needs a lot of repetition. So it needs to be very intentional. And our text here, Music and Special Education, provides some really good guidelines on how to really appropriately match a peer with the student who needs that support, as well as provide a little bit of training. And then, of course, supervision and monitoring of that relationship within the classroom to make sure that that peer relationship is going to be successful. And then things that we can do to alter the environment is, of course, the physical space. So the teacher, might need to place some instruments out of reach, towards the back of the room, a little up high. Maybe they just don't need to have all of the instruments setting out. So there's different things that we can do according to how much stimulation that we might need to reduce for some of our students. And then, of course, adapting instruments. At the very closer to the end of the presentation, we'll talk about different types of adaptive instruments. Anything from just adapting our mallets or some types of percussion holders, using Velcro. Velcro can be your best friend. And then ways to think about how we can use and reuse aspects of technology to also help adapt some instrument playing, essentially.
All right, so now we're going to get into some actual strategies that we can use to support students' needs in the music classroom. So we've broken this down into attention needs, then we're going to get into autism and sensory needs, specifically sensory processing disorder, which we'll discuss about how those are two typically comorbid diagnoses. And then we're going to get into the behavioral needs, as I'm sure everyone watching this presentation has dealt with that one behavior in their classroom. So we'll provide some strategies for that as well. All right, so we're going to start with attention deficit hyperactivity disorder. Fun fact, if you have not been following the new updates in the DSM-5, there's now a DSM-5 kind of like a sub edition before they come out with the DSM-6. There is no longer ADD. So there is no attention deficit disorder anymore. They have changed it to attention deficit hyperactivity disorder. And as well as they've basically made some more qualifications and kind of cleared up some of that. So what is ADHD? So ADHD is characterized by an ongoing pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. So when you're thinking about the symptoms, you're thinking about three distinct areas. So the inattention, or basically being the off task, having difficulty sustaining focus. We also see this in just organization. So if you have that student that just has a hard time staying organized, keeping information in an agenda, or even if you look at their notebooks and you can kind of see that maybe their music is out of place, or maybe they have one page of their music and then the other page is who knows where. So that could be a sign of inattention associated with ADHD. And then any careless mistakes. So, doing quizzes and you kind of see that, hey, the student knows this. We've talked about this in class, but maybe they just took it so quickly, or they weren't able to stay focused during the quiz to be able to think clearly. So you do see some of those careless mistakes. Hyperactivity is something that you're likely to very quickly see in the classroom. So if you see a student constantly moving or constantly fidgeting or tapping or talking, this is typically one of the first behaviors as teachers we have to deal with and sometimes nip in the bud. So that would be the hyperactivity you've seen. And then there's impulsivity. So acting without thinking about the consequences and difficulty controlling their behaviors. So when we're thinking about ADHD, we really do want to keep all of these symptoms in mind. And I want to kind of talk a little bit about what's going on in the brain, because a lot of the times we have our students, whether they're diagnosed or in the process of being diagnosed, These kids, as my supervisor and mentor teacher used to tell me, these are the BAD kids, the bad kids. But she said that in a loving way of basically saying they're not bad, but they're often labeled as these are my bad kids in the class. But I really want to emphasize that the ADHD brain is different than a non-ADHD brain. So when we're thinking about the prefrontal cortex, this lobe right at your forehead, this area of the brain in particular is where we have all of our executive functioning, our decision making, and our attention, our ability to stay on task. For people with ADHD, it functions differently, so it's easily switched. So it really is wired differently in the prefrontal cortex. So it's harder for them to stay on task and to be able to make those clear executive functioning decisions, and not make those careless mistakes. The other area of the brain I want to talk about is this blue area, the basal ganglia. So this is the area that basically is the communication center of the brain. So when this area is working properly, all the areas of the brain are communicating and interacting appropriately. However, in an ADHD brain, this often short circuits, meaning that some messages are not being relayed to other parts of the brain and some brain areas are not being shut off. So those messages are going and the basal ganglia can't say stop, like we got to stop this signal now. So that's when the communication system is gone in the brain, that's also what's leading to some of these behaviors that we see in the classroom. The limbic system, this area in the green, this is our emotion center of the brain. And basically ADHD brains, we can see a deficiency in dopamine, which again leads to that restlessness and attention and even emotional outbursts. So, and very quick emotional changes. And then finally, if you look at our brain stem here, we have the reticular activating system. So this is a major relay system between different pathways. So again, this is kind of where we see that dopamine come into play once again. And when this area of the brain is not acting the way it should, we're seeing that impulsivity and hyperactivity once again. So I just want us to all keep in mind that there's a lot going on in our kiddos' brains that are, dealing with ADHD. So some quick facts about ADHD. Approximately 6 million children in the US have been diagnosed or will be diagnosed with ADHD. Basically 5 years and before, we're seeing about 265,000 kids being diagnosed, and the number increases. So by the time we get into the high school age, teens in high school, we are seeing the 3.3 million. And some reason for this is due to the fact that ADHD presents differently in different genders. So for instance, boys are more likely to be diagnosed with ADHD than girls because boys will display more hyperactive behavior. So these are the behaviors that as teachers we see automatically. We see when they're getting out of seat, we see when they are, talking to their neighbor, and we see when they're just, constantly fidgeting. But girls with ADHD actually tend to display more quiet behavior. So are daydreaming and kind of just, shifting off balance. But as teachers, when we're in a classroom of 50 plus students, especially in ensemble rehearsals, we sometimes don't see that inattention in girls, and they also have ADHD, but they're often overlooked because it presents more silently than some of our boys. So as many of you know, most of the common treatments used to manage ADHD are medications. There are stimulant medications and non-stimulant medications. Most often you see the stimulant medication, so the Adderall. There are some side effects to Adderall. In fact, I've had several students, especially my teenagers, who say they hate taking it because they truly feel like their brain's in a fog when they're on it. So there's some struggles with that. But so there could be some non-stimulant medication that could also be in effect. But this is definitely, whereas teachers, we need to communicate with parents and, be a united front to find the best medicine that's going to allow our child to and our students to succeed. So, yeah. All right. So, I wanted to give you guys some adaptations for the classroom. The best adaptation, which I know many of you probably do on a daily basis, is just simply redirection. So now knowing what we know about the brain and just knowing that it's wired differently, if we can just remind the students of the expectations when they are off task, that will be great. And we don't have to stress it. We don't have to hound on it over and over again. Just a nice reminder to the students to remain to remind them of what they're supposed to be doing. This next bullet point comes with a story. So allow the student to move around, and I do understand, if appropriate, it's going to be a lot harder to move around a band classroom when you have lots of expensive instruments around. But during my internship in the Fulton County Public School System, I had a preschool special needs class for music it was like for my first class every Monday morning. And I had an adorable 4-year-old who was a holy terror, absolute holy terror. He was the first student I ever had that I literally had to call mom after class because he just truly went on a rampage. He could not sit still. He was hitting others. He was throwing instruments. I think he was tearing up song sheets. It just could not sit still, could not focus. So I worked with the mom, and I actually talked to the teacher. I talked to the mom to really find a strategy that would work for him, because I could also see that, yes, he was not doing what he was supposed to be doing, but he really truly just couldn't control himself. So what could we do to make him be successful, as well as make the music class successful for the other students? We came up with, if you're wondering why there is a picture of a sit and spin, one of the things the mom said is, when he's at home, like, he'll just kind of like spin around in a circle, and then he goes back to the task that he's supposed to do. So the school, I think in the preschool class or the kindergarten classroom, they had a sit and spin. We tried it out in the music class the next week. We just put a sit and spin at the very back of the classroom. We talked to that adorable 4-year-old before class and said, if you ever just need to get up and go spin, your spin is at the back of the classroom. You can just get up, go spin, and then come right back. And I was also sitting there wondering, is this really going to work? Because, like, is he just going to, like, just always go back to the back of the classroom and be off task and sit and spin? It worked beautifully. If he needed to get up, he got up very quietly. I also wondered, is he paying attention while he's back there spinning? He would come back and I would ask questions and he would be able to answer them. So he was even paying attention when he was at the back of the classroom spinning, looking like he's off task. His brain truly was still retaining the information. So while I know that not every classroom can have a sit and spin, and it's not appropriate to, maybe have some of your students get up and move around, but do allow ways to have students moving around if necessary. Something else I actually learned in a meeting is, even if you can provide like something to do, like, with their hands, even if it's just like playing with pipe cleaners, if they just need to do something and fidget with something, allow the fidget spinners in class for those kids that do need to just move. They are listening. It's almost just like that extra bit of fidgeting just kind of helps their brain zero in on what's going on. So it's just stuff to keep in mind. Miss Katie Whipple is going to show an example of a class schedule later, but definitely having a class schedule. So ensemble directors posting, we're going to do our choral warm-ups today, and then we're going to go over these pieces. If you can kind of give a time frame, that's great as well. General music teachers, again, providing like, this is when we're going to move around to music. This is when we're going to listen to music. This is when we're going to play music. That again just kind of helps our students understand what they need to focus on during this class and what can be expected. The other thing to think about, which does take a lot of planning on our parts as teachers, is giving tasks to students when you're working with another group or section. So, especially for ensemble directors, if you need to work with these first violin section, give the viola something to do. Like tell the students, all right, violas, you're next. You look at measures, 8 through 14 and make sure you're, got your fingerings, do your fingerings. The other thing you can do is like, especially with, all state auditions coming up and having to learn music terms, have like a music term of the day that the students, need to memorize, and then do like a, popcorn pop quiz of, okay, what does allegro mean? Who can, and, call, whatever you need to do, give them another task, because if you're working with another section, that provides kind of a break in the consistency of the class. And that's an easy time for them to get off task, start talking to neighbors, get into trouble. So, give them something to do. And then, as we've kind of mentioned before, and we'll continue to mention, if you can find a peer buddy that, it will be a good partner and a good pairing for that student, have that student sit with a peer that can help that student remain on task and follow the directions that they're supposed to be doing in the class.
So next, we're going to talk about supporting students with autism and also some of the sensory needs that can sometimes come along with also having that. So I wanted to give you, I always think it's important that we hear from people who have or identify with a certain condition, because I'm not autistic, but I think Temple Grandin is a really good advocate for the autism community. And so she's going to tell you in like 2 minutes or less ish what it feels like essentially to be autistic. And as you watch this, I want you to think about, what does this mean for a student with autism in my classroom? She mentions things about how she learns, about how she thinks, and about some other aspects of just how she feels about social situations. And all of these things are really important in helping us understand how to support students with autism.
You never get cured of autism. But what you do is you learn better, is you learn more and more things.
Well, I didn't speak until I was 4. Now I have a BA and a master's, and I'm studying for my doctorate.
I can remember the frustration of not being able to talk. I couldn't get my words out. My speech came in gradually, a few words at a time. When I was a little kid, I was very autistic, nonverbal, rocking. That's the kind of kid they just put away in the institution. But I had a speech teacher that worked really hard with me, and I can't emphasize enough the importance of young children getting early intervention. You got a 2-year-old or 3-year-old with no speech, don't wait. High school was absolutely worst part of my life. Teasing, teasing, teasing. I got kicked out of school for throwing a book at a girl, teased me because teasing really made my life miserable. And the only places I could get away from teasing was the specialized activities. Things like horseback riding, electronics lab, model rocket club. The line was drawn in the sand. I was not allowed to become a recluse in my room. I had to get out and do things. I'm always kind of baffled at just how illogical people are in their thinking. I'm very logical in my thinking. But when I was younger, I didn't know that other people thought more in words. You see, I think in pictures. If I don't have a picture, I don't think. And my mind is very, very associative. Being a visual thinker, I tend to put things into categories. You see, autism is a very big spectrum. At one end of the spectrum, you've got half the people at Silicon Valley. And then at the other end of the spectrum, you've got somebody who's very handicapped, remains nonverbal, is going to have to live in a supervised living situation. Really, really big spectrum. And, Einstein probably be labeled autistic today in a lot of school systems because he had no speech until age 3. I'm interested in seeing something that makes real change. I've done a lot of work that's made a lot of improvements in the livestock industry, and I think I've helped a lot of kids succeed. I want to see the kids that are like me succeed. That's the kind of stuff that makes me happy, when I see the things that I do make a difference.
All right. So there's so many good things about that I want to kind of hit before I talk about the next thing. One of the things is that she didn't start talking until a lot later than her peers, right? actually, she was diagnosed with autism later. She wasn't diagnosed as a young child. She was diagnosed later. So that's kind of interesting, but she's already gone from having really delayed speech to having her doctorate. So she's a famous animal researcher, and she has developed what she calls the hug machine. And it's something that she developed after I think she was in high school. She noticed that cattle really kind of preferred to be squeezed, to have this really proprioceptive and tactile input. And we'll talk about sensory systems in a minute. But she noticed that calmed them down. And so she created her own hug machine, and then she would use it on herself, and it would help relax her and help calm her. And if any of you have worked with kids with autism in your classroom, you may have noticed that some of them are wearing weighted vests. Some of them are weighted and some are just a little more compressing, and it's providing that basic input. So she's sort of a pioneer in that area, but she's also done a lot of other things as well. I think the other key thing is to think about how she talks about how she thinks in pictures, because we're going to take a look at some visual aids and talk about visual schedules like Dr. Peebles mentioned, but thinking in pictures is really important. And she's actually allowed people to do some imaging of her brain, and the occipital area of her brain, which is back here, which basically controls our vision, is extremely lit up and connected to almost every area of her brain. And when you compare that imaging to other non-autistic brains or neurotypical brains, hers is extremely lit up and really emerging from a lot of those areas. So literally on a neurological level, we can really see evidence of this idea of thinking in pictures. I think the last thought that I want you to really take away from this is how horrible high school was from her, being bullied. And I know there are a lot of students with autism who are bullied at school. And so I think if you have a student who does have autism that is in your classroom, also being really keenly aware of their interactions with other students to make sure that other students aren't doing things that are of that bully nature, just kind of having that radar on to really pay attention to those interactions, because social interactions can be very difficult for people with autism. Okay, thank you, Dr. Peebles. We'll go to the next one now. So some quick facts about students with autism. So currently the CDC says that 1 in 44 children have autism. And of course, this has increased significantly. In 2002, this measurement was 1 out of 150. And it's interesting how they get this information. They're really sampling students in a large select major areas or cities in the United States. And they're looking at a specific grade level. I can't remember if it's 3rd grade. There's a specific grade level. So that we know that the prevalence has essentially gone up, which of course a lot of that is due to just increased awareness about autism, but also improved screenings and the ability to diagnose this. And so with the new DSM-5, we do have different diagnostic criteria. And so we don't use terms like Asperger's anymore when we're diagnosing, but you might still have individuals who identify as Asperger's and consider themselves Aspies. And that's okay. So it's something to know when we're working with our students with autism. Another misconception is that, we used to believe that boys are 4 times more likely to have autism. And if you look in books, it'll still say that. But really there's some research. There's a study that I found from 2017, which is not quite so recent now. It's several years old now. But they actually found that it's maybe more like 3 times more likely that boys are 3 times more likely to have autism than girls. So we do still believe that in general, boys are more likely to have or develop autism, but it's not as drastic as we once believed. A lot of this is really due to diagnostic gender bias. Sometimes the symptoms that girls have when they have autism present differently, just as they do in ADHD and other diagnoses as well. So that's something else that's important to consider. It probably explains why Temple Grandin wasn't diagnosed until much later in life. Another interesting fact, there's some recent research suggesting that approximately half of individuals with autism have average to above average intelligence. So do not think just because a student has autism that they're going to have some type of intellectual disability. There's a huge percentage of individuals with autism who are not only have that average intelligence, but are extremely gifted and what we would call twice exceptional. And we've served students in our clinic who are twice exceptional. They have autism, but they are also in the gifted programs at school. And before I forget, you'll notice that there's 2 areas here in the text that have underlining. I think most of y'all are probably pretty aware that means there's a hyperlink, but I just want to make sure you know that there's hyperlinks. And whenever you see that underlining in our slides today, there's a hyperlink, and that I'm sure the presentation slides will be available to you so that you can actually look at some of this research and some of the links that we have. So let's talk about some specific behaviors and strategies. I think it's helpful to understand what the behavior might be that we see in our classroom. and understand why this behavior is happening so that we can really sort of address using some specific strategies. So the behavior. So let's imagine we have a student in our music classroom. They're not following directions. They may not respond to you really very much at all. Or if they do respond, it might be inappropriately. They might scream. They might hit themselves. They might hit their peers. There could be a lot of reasons why this is going on. One source of this behavior, or antecedent essentially, is really communication deficits. So the student just can't understand the directions. Or maybe they're just not able to express themselves to communicate effectively. They just don't have those skills. As Temple and Grandin mentioned in our intro here, it was frustrating for her because she knew she had once that she wanted to communicate, but she couldn't. That's frustrating. So imagine if you couldn't tell someone that you're in pain or that that sound really hurts. It can be very, very frustrating. So we are going to see some behaviors. So some strategies that we can think about is to help with these communication deficits that a student might have. We need to learn how they communicate, essentially, which we can find out from that one sheeter, from the IEP information and being there. How does that student actually communicate? Using visuals to give directions, making sure that you have their attention before you give directions, right? And so as a teacher, you're taught a lot of those classroom management skills, how to get that attention. But for that one particular student, you might have to use a little more proximity, get a little bit closer to them so that they can really hear that you're trying to communicate. And then we're going to talk about some alternative communication systems in a visual schedule. So let's take a look at some of these a little more in depth. So AAC, which is really just a nice little acronym for augmentative and alternative devices. Essentially, now this comes from the American Speech and Hearing Association, ASHA. They define an AAC device as any means that a person communicates besides talking. They also say that people of all ages can use AAC devices if they have trouble with speech or language skills. And so when we say augmentative, we're talking about adding to someone's speech. When we use the word alternative, we're talking about using that instead of their speech. And so some people will use AACs throughout their life, and some of the children or students that you work with may be using AAC devices. And this may be true not just for our students with autism, but for our students with other types of disabilities as well. And when we're thinking about AAC devices, we really have several different options. We have no tech, low tech, and high tech. So let's go to the next slide and we'll take a look at some no tech strategies. And this essentially gestures ASL. Okay, so if we think about American Sign Language, and I've worked with students who, have autism, they also have hearing impairments, or maybe this is just how they communicate. A lot of times when I'm using ASL in the classroom, it's not because students have a hearing disability. It's really because that visual information is so helpful. So if you're a person that thinks in pictures and you're being provided a symbol, that helps them to understand that information. So when I'm thinking about ASL signs in my classroom, a lot of the signs that I might be using are music, which is, I don't know if y'all can see me, but music. This is sing. So we've got sing. Please is a big one that I really work on a lot with my kids, is saying please. And then, of course, thank you is always very helpful. Another thing that can be really helpful for our students with autism who have a hard time communicating is just being able to say they're enjoying the experience and they want more. I want more of this. I want more instrument. I want to play this again. I want more song. And then, of course, all done, just to communicate to them, it's time to put the instruments up now. We're all done. We're all done with music. We're all done with singing, etc. We also have play. I don't use this one a whole lot. Generally, if I'm talking about it's time to play an instrument, I more gesture the instrument itself. But that is the sign for play. And then stop. So these are key signs. It's not that we have to learn all the ASL signs, but which ones are going to be most important in that music classroom. And then, of course, just gestures. Thumbs up, thumbs down, having students be able to wave, shake hands, pointing, things like this, nodding head. So these other gestures can just be, again, another way to help them understand what you're saying, but also give them ways to communicate with you. The next one we'll take a look at is our low-tech AAC devices.
And if you don't mind, I also would
please.
love to throw in one extra thing. Some school systems will also have like a PEC system. And that is basically, again, as we've already done a huge shout out to Velcro, and Velcro is not sponsoring this presentation, but maybe in the future. But it's basically like a board with a strip of Velcro and then different pictures. And a student can take that picture, stick it on the Velcro, and show the instructor So that's kind of another way, and in a low tech way and an easy way a teacher can, communicate with that student, to again, and it's helping the student learn to communicate, wants and needs. So it's great skills for all. Okay, sorry. Thank you, Katie.
No, you're absolutely fine. And that was one. So if you see this link down here on the bottom right, the Picture Exchange Communication System, that's what that PEC stands for. A lot of special education teachers do utilize that. They will utilize that in the classroom. So again, going back to this idea of how does my student communicate, or how does this student communicate? If they're using some type of specific system like PECS, what visuals can I use consistently in my class, that will allow them to make decisions and be able to express what instruments they want to play, what song they want to play. If they're all done with music and need a break, or if they need to go to the bathroom, they can give you this information. The first thing on the left, so when we're talking about low tech, I mean, it's just, these are easy things that you can put together. That one on the bottom right, the song choice board, I just made that in, I think it was Microsoft, not PowerPoint, but what's the other fancy one, Publisher. Really, for a lot of kids, that might be too many options. We might have some kids that that's just too much information, but you can take this idea of song choices and having some type of visual representation, and maybe you just present them with a choice of two. Or here's 3 songs, like pick which one. But you could use a whole board. I actually already have one here in my office printed out. I don't know where it is. Oh, I have a lot of these visuals that I use, and I will punch a hole in them, and I have a binder, and then when I'm in my session, I just yank it out, so that my kids can actually communicate something in that session that we're doing. So, maybe in your general or early childhood classroom, that might be a little more appropriate. Instrument choices as well, helping them make some decisions about what instrument. You, of course, would have control over that. If you're in an ensemble setting, what other auxiliary instruments might we need to help them make those choices, if they're not able to, if you don't want to bring out all of the instruments and present it to them. All right, the last one that we'll take a look at is the high-tech AAC devices. So there are apps, and we'll actually watch in a minute here a music therapist working with a young girl with autism, and looking at what she can. If you see this one on the bottom left where it says yes or no, there are different apps that you can get to put on your iPad. That will allow the students to essentially be able to communicate with you. There's a link there for more AAC apps. And if you click on any of those images, those will also take you to those web pages. Some of them are just iOS, some of them are Android based. But you could utilize some apps within that classroom to help students. And some of them might be using them already in their classroom. We could also think about speech generating devices. So on the bottom hand right, you'll see 2 different types of AAC devices. The first is called a Big Mac, this step-by-step, and I left mine in my car because I'm using them on Fridays with a group of kids that I have. I have one little boy in my session. He does not have autism. He has cerebral palsy, but he also he has to have another diagnosis. I haven't looked at his paperwork extensively to see specifically. I wouldn't be surprised if he did have autism, to be honest, but he's basically non-speaking. And so at different points in the session, I have opportunities for him to vocalize through our step-by-step Mac. So I have it set for hello, and it's in tune with our hello song. And then I have one for goodbye. And then we're working on a performance piece. We're going to be performing a song called Raining Tacos. And our students are really working on vocalizing. A lot of the students in this self-contained classroom, probably only 50% of them are actually speaking and the other half are non-speaking. So I'm really trying to encourage any kind of vocalizations. And so his is programmed for pizza. He likes pizza. And so when we cue him within the song, he's going to be singing It's Raining Pizza. So that's one way that he can contribute to the music making part of our song at a level that will allow him to do it. But it's utilizing a speech generating device. So it's not just limiting itself to speech. We can think about how we can use it to actually help them make music. Then we also have something called the Super Talker. I'll show you all that in a little bit when we look a little bit more at some of the adaptive instruments and technology. The Super Talker, again, I have used the Super Talker in multiple ways with sessions. You can actually have, in this particular model, you can have 8 different switches. So you could essentially have 8 different students activating 8 different sounds, or 8 different notes, or 8 different rhythms, or melodic lines. You can do all kinds of things. However, you could just use it in your setting to have them make some choices about what instrument they want to play. So instead of having these coins here that you see on the screen, it might be a variety of different percussion instruments or a couple of different notes. so that they could actually make some choices. So a lot of different options to help them communicate.
Oh, sorry, I clicked on a link.
Did you?
Clicked on a link by accident while I was trying to switch slides. Okay, we're good.
There's lots of links in our slides today. So Dr. Peebles mentioned the visual schedules earlier. And again, this can be extremely helpful for our students with autism. They provide predictability. Sometimes it's just the not knowing what's going to happen next that can create a lot of anxiety for our students. So these visual schedules can assist in transitioning essentially from one experience in the class to another experience in the class. They can begin to anticipate what's going to be coming next. It can also assist in just transitioning to and from music class. Some students we work with might have a hard time just going from one classroom to another and then perhaps into your classroom. Just a quick Google search on teacher, or actually just Google, took me to Teacher Pay Teachers, and I was blown away by how many different visual schedule images are available to you. So there is a direct link there, and there are some affordable options. What you see here on the right are some snapshots from a free visual schedule that's available on Teacher Pay Teachers, and there's a lot more than just play, move, listen, and read. There are a lot of them, and again, it's just helping them understand, what are we going to be doing first? What are we going to be doing second? There was a kid that we worked with in our music therapy clinic with autism, and the visual schedule that I did for him, I mean, it was just on a poster board with Velcro. And, you know, we would have our sessions. These are some of the cards that I would Velcro up, and they would be in a line. And as we did them, he would either take them off of the visual board, off the board itself, or move them. Another thing that he really liked to do is just like take it and get a dry erase and mark through it. It became very clear he was finished with that, and then we're going to the next thing. And then I would always strategically place the thing that he really, really wanted to do towards the last thing, so he could understand we had to get through this and this and this. We had to do our work, and then we could do the fun stuff. So just thinking about how you can help in whatever setting you are. And this will be helpful for not only our students with autism and ADHD, but really all of our students. I think most of us kind of want to know the schedule of our day and what we're going to be doing. And that's just kind of part of being human. So.
And I did work with a high school student, high functioning autism. And what we would do before every lesson is we would write out the schedule. So it wasn't a visual schedule, but it was actually, you know, we're going to start with this piece. We're going to play this piece. We're going to play this piece. We're going to do a little bit of composition. So one thing that you could do for those of you in ensembles, you know, we have to have teacher lesson plans anyway. If you can just make a really, really quick, like, you know, Word doc of, you know, this is what we're going to do today, you could hand that to that particular student, and that student could have that schedule on the music stand and then just strike through, because that was something that was very important to that student I worked with, is that after we finished a song or we finished playing a scale, we struck through the schedule, and that his anxiety just decreased immensely, because he could see that we were moving through the schedule, and he could also see when we were going to be done. So it also even helps transition out of music, since we know, again, there's some troubles transitioning. So and it helps with transitioning to the next activity, seeing that we know what's happening next. So
good point. And I think, you know, a lot of us function off to-do list, and that there is that satisfaction of, there we go, it's been marked off, what's next? So I like that strategy. That's great. So another behavior that we might really observe in a student with autism in our classroom might be perhaps the students having a hard time interacting with their peers, or maybe sharing class materials. Maybe they always are wanting to go first and really have a hard time waiting until it's their turn. They might also isolate themselves from their peers, or really just not interact very much with their peers. And so the why of this, go back to with what Temple was telling us, or Dr. Grandin was telling us about interacting with people. It was difficult for her, and part of the diagnosis or diagnostic criteria for autism is the deficits in social interaction with people. Sometimes it's just that the students have a hard time understanding the social cues of others, and as they get older, sometimes that they've had enough life experiences to begin to understand what things mean when people do it, do a certain behavior themselves. Like I know it's time for class to be over when I'm teaching, when my students start shuffling their books and getting them together, or putting their laptops away, right? That sometimes our students have a hard time picking up on the social cues. They also may not have developed this idea of theory of mind. So theory of mind is something that comes up a lot in psychology and just development. It's essentially being able to understand that someone else might feel or think differently. And really, it's not like we either have this ability or don't have this ability. It's really something that we develop. The research says we begin developing it around 18 months, and we continue to develop it all the way until we're 4, 5, 6 years old. So this idea that we can understand that I might like doing something this way, but somebody else might not like doing something this way, that might not quite be yet a skill that our students have, right? So when we think about some strategies, we could implement some cooperative learning groups where we really strategically think about, okay, we're going to try to place this student with autism who's having a hard time interacting with other people with this particular student who is just kind of naturally patient and really wanting to get to know other people. It's also going to be a matter of communicating clear rules and expectations and really following through. We also want to reinforce any positive interactions that we see with what we would call like a social reinforcer, where we provide some reinforcement. We want to be specific in that reinforcement, not just tell, oh, Joe, good job. Like that's extremely generic. We need, if we're going to provide that reinforcement, it needs to be specific. Joe, I really liked how you played or shared that instrument with someone. I really like how you were listening on that musical part. You were listening to know what to play. You were listening to your friend. And then, of course, we need to also have some consequences for negative behaviors and really follow through with those things. So if the student's not supposed to be snatching an instrument from someone else and they do, what is that consequence? So making sure it's clear and then following through with that. But the next thing that I want to talk about when we're talking about social interaction deficits is this idea of social stories. And so some of you may or may not be familiar with social stories. It was essentially developed by this really amazing person working with students with autism over many, many years, really back in the 80s. But she first published this article, Carol Gray, in 1993. And basically, she has kind of, marketed this whole idea of a social story. And so we see this a lot. There's been a lot of research in using social stories. But what she found is that the students that she works with autism, who sometimes have these social deficits and have a hard time understanding the social cues and world around them, if she places them, the things that they're struggling with inside a story that is very clear about, what the expectations are and really has a lot of other defining criteria, it helps the students to be successful. So she defines a social story as accurately describing a context, a skill, achievement, or concept according to 10 defining criteria. So you'll see I've got 2 different links here. Over the years, I think people have kind of taken this idea of social stories and kind of created their own idea of what they are that could be possibly harmful or demeaning to individuals with autism. So some of the things that we want to do and be wary of when we are trying to create a social story for a student with autism is we want to use I statements. The story needs to be put in that student's perspective. We need to use positive, just language. We want to talk about what we want the student to do. So let's see. When we go to music class, we sit on our square. We sit on our square. When we go to music class, we sit on our square. We went and sang, when we go to music class, we don't hit our friends. We don't hit our friends. We want to talk about what we do want them to be able to do within the story. We also want to answer a lot of the what questions, the who, what, when, where, why, so that they really understand the context. And focus on those things. So we can take this idea of a social story and we can set it to music and we can create little musical stories. But I would really highly recommend that if you use this, and I think a lot of this would probably be most appropriate in like the K-5 music classroom, is to really take a look at Gray's philosophy about social stories and her criteria to make sure that we are not being more harmful than helpful, because we want to be respectful in our language. And she's got some really good criteria to adhere to. If you are interested in learning more about how to create musical stories, there is a link there to a YouTube video. It features a music therapist, Ryan Judd, who tells you a little bit more about creating social stories. There are some some Storymaker apps. There's a link there for different, digital ways of creating a social story. If you wanted to incorporate visuals, or if you wanted the student to put it on their own device and be able to take it with them later. If you're using it in a larger classroom, you might want to consider just using PowerPoint. You can use PowerPoint, put in pictures and text, and you can have the slides set to advance. And then that way you can be accompanying yourself and singing so that the whole classroom can benefit from the social story. Because when we are in that K-5 setting, that social emotional development is extremely important. And they all need help with understanding about turn taking and sharing in people's personal space and all of those things. So that's a little snippet about the musical social stories. The last behavior that I'd like to kind of mention when we're working with students with autism. So let's say we're in the classroom, they're in music with you, and all of a sudden they start to cover their ears. Sometimes we see this a lot when we're working with kids with autism. They might also reject touch from others. You might have gone to try to offer a little bit of support to put to sort of guide their hand to the correct note on the ORF instrument, and maybe they are not able to tolerate that. Sometimes we might even have students that might throw instruments. I had a little girl that I worked with. If the instrument was light, she was going to throw it. So, a shaker, she was going to chunk it. A mallet, she was going to chunk it. So I finally found an instrument. It was really just a C pentatonic scale. It was about this big. It was a quality instrument. It was wooden and it had a really nice, tone to it. But there were mallets attached to it that were literally attached to the instrument, and she did great with this. She couldn't throw it. She didn't feel the need to throw it because the instrument itself was heavy and everything was attached. So sometimes we might have students that want to throw instruments, and it's not because they necessarily think it's a ball. Sometimes that is the case, but sometimes it has to do more with their sensory systems. So when we see this, it is often related to an oversensitivity to sensory input. The student might literally be experiencing that stimuli as painful. Okay, so when we have a student who is, you'll see different terms, oversensitivity or hyper-responsive. They're hyper-responsive to a certain stimulus. It literally can be painful for them. It's not that they're just, can't stand the ice, somebody chewing on ice, that it's irritating. It's literally painful. Hyperacusis is the term that we use when we are talking about someone who does have an oversensitivity to sound. And we do have students who have hyperacusis, so we have to be aware of. So some specific strategies is really observing how that student responds to sounds, as well as the other stimuli, and then trying to avoid that stimulation, and make sure that it's tolerable for them. Also being mindful of volume level and the types of instrumentation, and then also just allowing time away from class when they need to, or an area of the room that is not as stimulating. So we'll go to the next slide and we'll talk a little bit more about just sensory processing in general. So I feel like it's important to mention this when we're talking about individuals with autism, because you'll notice the very last bottom bullet point, it's estimated that 90% of individuals with autism have a sensory processing disorder. That's a lot. That's a really big percentage. So chances are that you're going to have an individual who has some type of sensory dysregulation, and it may not be with sound, it could be with something else. And we'll take a look at the sensory systems as a whole, but there might be something there that we need to investigate, because the behavior is not that they're just don't want to be there, or that they're trying to just, make things difficult in the classroom. It's that this is painful for them, and we need to figure out how to accommodate for that. So what is a sensory processing disorder? Okay, by definition, it's a heterogeneous condition that includes a variety of subtypes. So it's varied, lots of different things here. Individuals with the disorder have impaired responses to processing of or organization of sensory information that essentially begins to impact participation in a functional way. It impacts their ability to, go to Walmart or do some of the things that are required of us. The thing to know about sensory processing disorder is that it's not a standalone disorder in the DSM-5. It is not its own disorder. We tend to think of it as a symptom of autism spectrum disorder, but it is also known to be associated with students with ADHD as well. So that's something to keep in mind. So let's take a look at sensory processing and it's different functions. So if you look on the right-hand side of the screen, you'll see we have vision, auditory, gustatory, olfactory, and tactile. Those are the ones that we tend to think of the most when we think about our sensory system, but there are really 3 others, 2 of which might be a little more familiar to you. At the very bottom, we have vestibular, really, just relating to our balance. It has a lot more to do with like where our head is and being able to feel where our head is in relation to the space so that we can accurately balance ourselves. Essentially, when we are just walking from point A to point B, we're relying on that vestibular system. And then we have proprioception. Essentially, our ability to be able to touch our nose, be able to find our elbow or tap our head, all of those things, and knowing how much force to put behind it or how to get there, all of that's related to our proprioception. So I like to tell my college students that when their roommate comes home inebriated, not them because they don't drink, it's their roommates. When their roommates come home and they can't hardly walk, it's because their vestibular system has been impacted by the alcohol. And then when their roommates can't really get to the refrigerator door to open it or do what they need to do or just even touch their nose, that's their proprioception. So those are also 2 systems that we may not necessarily know the words for, but we are very familiar with. The last one is interoception. And literally Microsoft Word doesn't accept this as a word. And you won't see this a lot when you're looking at sensory processing. But interoception is essentially our inner body awareness. It's our ability to be able to feel our heartbeat, to be able to detect when we're hungry, to be able to tell when we get those butterflies in our stomach. So some individuals that could be they may not be getting enough of that information. Essentially, when we get highly anxious, we become very aware of our heartbeat and things like that, right? So this is another separate sensory system, but one that might be less known. All right, let's move to the next slide. And I want to talk about a little bit about different patterns of sensory processing. There's 3 main patterns. However, again, this is not in the DSM-5. It'll be interesting to see how our thinking about sensory processing changes. There's several different really models and ways that we think about it, but I want to talk about the different patterns. So when we're talking about patterns of sensory processing, it's really how much information are we receiving or not receiving and responding to this information. So we might have some students who are hyper responsive to certain stimuli. This means that the student is over responsive. They might respond too much. They might respond for too long. Or to stimuli of weak intensity, and they might take longer to recover from some type of overstimulation, and they might literally quite experience pain and distress. A good example of this is we have gone in to do our sessions in the school system, and they have just come from a fire drill, and we're not having music therapy that day because there are several students in that class who are still overstimulated and are literally having a hard time. They are not able to regulate their sensory system. They have over responded, whereas most kids, by the time they come back into the school, they're fine. They go back to class, they're able to function. However, some children are going to be responding for too long or taking too long to recover. And in these instances, these children are hyper responsive to sound. Sometimes when this happens, we might have students who then, again, to avoid these sensations, essentially. So they might do things like cover their ears, or just simply turn away. They just don't even want to like face wherever that sound is coming from or face that visual information. So you might begin to see them avoid it. It can become so severe that sometimes they won't eat lots of things, and they have to really go to therapy to get used to eating and putting different textures in their mouth. We also have on the flip side hypo-responsivity, which is where a student is essentially under-responsive. So they might respond too little or need a lot of stimulation to help them become aware of a certain stimulus. On the outside, they might appear uninterested or even withdrawn in the classroom. So if you're in, you're in your music classroom and you have a student who has autism and they are not really playing the instruments, they're not really looking at you, they might be looking other places around the room. You're providing, instruction or music, and they're just not responding. Chances are they're probably hyper responsive to possibly sound. And possibly even some of the other stimulation that they might be experiencing. Sometimes when students are hyper responsive to certain stimuli, they might seek that sensation in other places. So the student might respond with intense searching for more or strong stimulations. You might notice this through a student that's vocalizing a lot. They might be fidgeting, they might be touching, or just moving things around. So sometimes we might have kids who are just spinning in circles. So Laurie, when you were talking about the kid who needed the sit and spin, I was kind of wondering about his sensory, like, if he was really just seeking that sensory input. And then once he had it, he was able to regulate himself. Because the thing with the sensory processing is, we're constantly, as we're sitting here and watching this presentation, you're listening to my voice, you're looking at the screen, you feel the seat under your seat. You might be hearing a dog barking in the background. You might be a little bit cold. You might be a little bit hungry. You've got a lot of information coming at you, but you're able to inhibit or tell your brain to be a little more alert to different stimuli that you're being given. When we have that sensory processing disorder, that's hard to do, and we can become very dysregulated. And so sometimes we will see this with our students who they just need extra input, or they will avoid certain things. They're trying to regulate these things. So we need to think about how we can support them in that setting. We'll go to the next one. So some strategies. Try to identify that pattern, that student's processing pattern. It's important to remember that with our 8 different sensory systems, we could be hyper responsive to one stimulus and then be hypo to another. It's not that we're over responsive to everything. There's a mixture. So we really want to figure out what it is for our kids. A lot of students, or a common mixed pattern that we might see, is a hyper responsivity to sound, to auditory stimulation, as well as tactile stimulation. But a hypo-responsivity to vestibular or proprioceptive stimulation. So you might have a kid who the sound is too loud, this is just too much, and they can't tolerate holding an instrument. They might throw it, but they might leave their seat and they might just be spinning, or they might just be running around the room, or they might just be coming up and trying to squeeze and feel things. This is different patterns of that hypo and hyper responsivity. There's a link down here at the bottom that will actually take you to this chart here. I like this chart because it kind of gives you an idea of what it might actually look like if we're working with a student and they are either over responsive or under responsive or sensory seeking within a certain area. So if we go down to the sound stimulus down here, it says sounds on the left. Under over responsive child, that child might cover their ears to close out the sounds. They might complain about noises such as vacuum cleaners or noises that other people wouldn't really necessarily bother. If they're under responsive, they might ignore ordinary sounds and voices, but may turn on to exaggerated musical beats or extremely loud, close, or sudden sounds. And if they're seeking that sensory stimulation for auditory, they might like loud sounds, and they might like really loud TV, and they might love crowds. So these are things to think about. I think it's helpful for you to take a look at some of the others. So if you do see some behaviors in the classroom that might be related to sensory processing, you can kind of understand what some of that is, because it could be, as Dr. Peebles mentioned earlier, just allowing that child to get up and get some of that, I want to say energy out, but kind of moving in a way that's going to fulfill that sensory input that they need, and then get back to the task at hand. If it's touch, maybe they do need something that they can hold. I've had some students who don't want to touch an instrument. They can't tolerate an instrument. This is a shoe tambourine that you can put on the top of your shoe. I have used this for students who can't tolerate physically touching an instrument because it's on their shoe. They might be able to feel a little bit of pressure from it, but it's very lightweight. They can still make a sound, and they don't have to actually touch it. And so sometimes that's been successful using something like that if they're a little, I guess, hyper responsive to tactile stimulation. So how do we set up an environment where we can try to accommodate this? So there's a couple of different things that we can do with our students with autism who might have some sensory processing dysregulation. So some auditory adaptations, we can think about simpler music, less texture, obviously more consonants, maybe using music that has more grounding rhythm to it. We might need to decrease the auditory stimuli overall. So being just aware of how loud we're being and the different types of instrumentation. We might want to just decrease the volume overall. You might want to consider allowing them to use noise canceling headphones. There is a really neat resource here you can check out that has all different types of noise canceling headphones. There are some that will allow you to still hear certain sounds, but sort of mask out other sounds. So that could be helpful. We do have some students that we work with who are just wearing them pretty much all day. So if that's something that they're using, allowing them to use them in your classroom. And then avoiding auditory surprises. So just being careful, especially if you're in that band environment. There's a lot of sounds, at least percussion wise, that can be very jarring. So just being aware of that and trying to provide them with a little bit of anticipation if they're all of a sudden going to hear a cymbal crash. Sometimes it's just a matter of letting those students be the ones in control of that sound. And if they're in control of that sound and maybe they are doing that one cymbal crash 1 or 2 times in that song, maybe that's enough to kind of prevent that overstimulation and also allow them to participate. We could also adapt visually by minimizing distractions, putting away unnecessary equipment, thinking about our lighting. I know sometimes you can't control all these things, but I mean, even in a band environment, using the little clip-on book lights on the music stands and having a fun flashlight Friday, where you're reading your music and everybody has their little flashlights on their music, and that kind of creates a nice little environment. It can kind of help a little bit with that lighting for that student. I've gone into several classrooms where they just completely cover the fluorescence period for their entire class for the self-contained classrooms. And when we're talking about physical adaptations, just creating that calm space, a separate area for when they're overstimulated that they can go to. So letting them know in advance, if the sound becomes too much for you, go take a time out, go sit over here, here's your iPod, listen to some music, and then come back whenever you can join us. Okay, we can go to the next one. So I think, I'm not sure with time if we really want to watch this. I think what I would invite you to do, there is a link here. It's the smaller letters. It says YouTube Watch. This is a good little 5-minute video of a music therapist working with a young girl with autism. And basically, when you watch this, I just want you to think about, what kind of sensory responsivities do you notice? Can you tell that she's having to any kind of tactile or auditory, visual stimulation, anything like that? What type of sensory seeking or avoiding behaviors you might notice, and then kind of thinking about the music. He very intentionally plays a very slow tempo. He essentially plays around 60 beats per minute. And the little link at the bottom takes you to, he's got a whole, I can't remember how many songs, but he has all of his music available. That's very nice. So maybe it's even a situation where as students are coming into your ensemble room, or as they're coming into your K-5 room, you have some very peaceful, calming music set at a very slow tempo, very simple instrumentation, so that as students are coming in, not just the kid with autism, but all the students are coming in to a relaxed environment and using music to kind of set a calm tone before music gets started. So watch that video in your spare time. It's a really, really good video. I've even seen videos of autistic people going, this is a great video. And I love how this guy's interacting with her. So he's got a lot of good strategies for you.
And Miss Whipple, I wanted to say it's not just students with autism. After traumatic brain injury, I struggle with all of this stuff myself, and I can confirm that everything that you're saying is accurate in my case, and your strategies do seem to work in my case. So it's not one of the things I do when I teach like exceptional child is, of course, in music ed, we're more interested in the accommodation than the diagnosis.
Right.
So we spend a lot of time looking for the things that are similar between. So at least for me, this is part of my traumatic brain injury, but I did, mess up that frontal lobe a little bit. So
yeah. Tina, would you say that it's painful? I think sometimes people have a hard time understanding that it can be quite painful. Like this is irritating me. This hurts.
Well, it's not painful to me so much as it's just oppressive.
Okay.
And that's the best word, like the grocery store. I do Instacart because the grocery store, if it was designed to be overstimulating, couldn't be any more overstimulating than it is.
Yeah, Walmart in particular, I find overstimulating. Right?
Yeah.
Yes, absolutely.
Going back to what Dr. Holmes Davis said, I would also like to also reiterate that is so true, and that's what I found in my research study. My thesis research was looking at making accommodations in the general music education classroom with a young girl with an intellectual disability. But the interesting result of the study, and one of the other themes that came out from it, is that it not only the different accommodations that we put in place for that student the music educator, as well as I, as the researcher, we noticed that the other kids in the classroom were also responding and doing better and learning the material. So it is true, like, yes, we're talking about, particular students have diagnoses, but do keep in mind that, these strategies could absolutely help others. And yes, I know as music educators, you don't always have time to think about, who in the classroom has what diagnosis when you're looking at a sea of 50 plus, but do keep in mind that some of these strategies could be beneficial to many students, not just the ones that you're intentionally setting these adaptations for.
Absolutely. Thank you, Dr. Peebles. That's really great advice. All right.
All right, and let's get to the behavioral disorders, because I know that this is always what we look forward to as educators, finding those behaviors and taking in a deep breath before they walk through the door. What is a behavioral disorder? It's any persistent and repetitive pattern that violates societal norms or rules, seriously impairs a person's functioning, or creates distress in others. So I have primarily worked within the emotional behavioral disorder classrooms. That was a huge part of my music therapy internship. A lot of my students had anywhere from just hitting, like, I had a student throw a ukulele across the room and then tackle a peer. And then I also had classrooms in my middle school classes where the kids had already been arrested, and had, had police reports about things they've done. I also worked privately with a client who burned down his family home. So this truly, what I'm getting at is it truly, like, this violating societal norms. This is just not someone having a bad day and acting up. These are pretty serious behaviors. Some quick facts. So when we're thinking about, at least statistically, who was diagnosed with behavioral disorders, males outnumber females 5-1. And I also feel like I would be doing a disservice to not point out that Black males are overrepresented within this diagnosis. So, yeah. There's gonna be, we need more research and definitely more understanding as to why there's an overrepresentation. So some common diagnoses are oppositional defiant disorder, intermittent impulse control, conduct disorders. I would like to specify that in Georgia, in particular, within the Georgia education system, these different disorders are typically all classified under emotional behavioral disorders. This is not a diagnosis in the DSM-5. This is something that Georgia specifically uses. So I threw that down at the bottom just so, since we're in Georgia and you guys are teaching in Georgia, know that emotional behavior disorder could encompass some or all of these diagnoses in that classroom. When we're talking about behavior, I mean, we could probably do an entire lecture of you guys just telling us what behaviors you've seen in class, and we would probably even get a well representation of all the different behaviors that you could possibly see in a class. So I kind of just want to give you guys some tools to be able to kind of help identify behaviors, how to record behaviors, and then how to help be a part of that conversation within the school system to create a behavior plan. So when we're thinking about behavior and trying to at least start pinpointing what we're seeing and when we're seeing it, we need to think about these dimensions. So there are 4 dimensions to keep in mind: the frequency, intensity, the duration, and the age appropriateness. So frequency, we are probably pretty familiar with. How many times or how often do we observe this behavior? So if a kid's getting out of the seat, how often are we seeing it? If a kid is throwing an instrument, how often are we seeing it? If a kid is shouting out in class, how often are we seeing it? The intensity would be, how extreme is this behavior? Talking out of turn is not as extreme as throwing an instrument, because obviously someone can get hurt. If it's going to hurt someone or themselves, that's not good. I've had several kids who, when they get angry, they'll start hitting themselves. And I'm not talking about like a nice little, oh darn. I mean, just really hitting their head. I've even had kids run up and start banging their heads against the wall. So how intense is the behavior? And then the duration, how long is this behavior lasting? Is it very quick? Does this tend to, are they completely dysregulated that this goes on for 10 minutes and it takes, that long just to kind of bring them back down? So how long did the behavior last? And then finally, especially when we're thinking about, K through 12, what's the age appropriateness of the behavior? Having a temper tantrum at 14 is not necessarily age appropriate, but a temper tantrum at 5, yeah, you're going to see it. We don't want to see it. We don't want to deal with it, but you're going to see a temper tantrum at age 5. So does the behavior fit the age of the child? So the other thing I want us to think about is the externalizing versus internalizing behaviors. We're going to start with externalizing behaviors. So externalizing behaviors, this is showing aggression towards peers or objects. You may see arguing. It may be like forcing the submission of others through physical or even verbal, like actually, we could also say bullying. Being non-compliant with reasonable requests, asking a student, get your instrument out of your case and, them saying absolutely not and pushing their case away. That would be non-compliant. Exhibiting persistent patterns of stealing, lying, or cheating. Frequently exhibiting lack of self-control and acting out behaviors. Again, throwing tantrums, again, if age appropriate. Think about that. Hitting, spitting, scratching, biting peers, throwing objects. I added setting fires because I truly have had kids, both in private practice as well as in the school system, that did that as part of their behavior and was literally in their behavior plan. And I've also had kids who, in their police reports, harm animals. So that's, again, any kind of this behavior that is external. It's happening to someone else. It's happening to others. It's being expressed outwardly. On the flip side of that, we're going to talk about internalizing behavior. So this is, these are our quiet kids. These are sometimes the kids that are often overlooked. Like maybe we eventually identify it, but as educators, again, when we're looking at a sea of 50 plus kids in our class, we automatically see the externalizing behaviors because we need to put a stop on it. But sometimes the internalizing behaviors we overlook because these kids are being quiet and they're being quiet and they're, not causing a scene. So these kids play alone. Maybe there's sudden or frequent crying. You may see some anxiety signs, so complaining of severe headaches, stomach aches, nausea, feeling dizzy, feeling like they need to vomit. You could also see a decrease in interest in activities that were a previous interest, so depression symptoms, as well as, again, our quiet kids, our kids that rarely speak. So going back to this, males outnumbering females 5-1, I want to point out that males with behavioral disorders tend to have externalizing behaviors, and females tend to have internalizing behaviors. So I want to stress that it's potentially not that males are more likely to have behavior disorders. It's truly just that males are going to be diagnosed with behavioral disorders quicker and more frequently than females because it's externalizing. It's more likely to be an externalizing behavior versus internalizing. Not saying that males don't have internalizing behaviors, and not saying females. I've worked with several females with externalizing behaviors, but that just tends to be the trend that we're seeing within research and even within psychology. So, we are in education, so we need to know our ABCs. So these are the ABCs of behavior to keep in mind. We want to think about the antecedent. So what happened before the behavior occurred? I had a kid in band who would come into the classroom, he would be fine, and all of a sudden the band director would say our favorite saying, one more time. They would do it one more time, and the band director would say, all right, one more time, and then I would see the kid start to flip. And the behavior, RB, the kid would just I saw him push a stand once. I saw him just put his instrument away, and even just throw his instrument on the ground. And then the consequence, what happened after the behavior occurred? Well, band director got mad, kid got written up and sent to the principal's office But what was happening, this antecedent is very important. What was happening is this kid needed a schedule. And the band director said, we're going to do it one more time. And I know this is our favorite phrase as band directors, but for our kiddos that truly need a schedule and they need to know what to expect, it helps them regulate, what's going on in their brain. If we say one more time and then we don't follow through with what we say, at this point they're off schedule and they're trying to regulate themselves again, but until they can get that skill and really practice that skill, we're going to see a behavior. So finding a appropriate consequence, and helping that kids, with that, learning to self-regulate and learning that sometimes we're going to have to do things more than once. And it's also maybe even the band director saying, okay, I've got to break this skill of saying one more time when it's going to be more than when we need to do it until we get it right. So, and maybe being very clear, like, we're going to do this until all the clarinets are playing piano and I hear the trombone line come through the band. Like, being very clear with what it is that we are going to do this until, so that way that student can process, all right, well, until those clarinets play quiet and that trombone line is heard, where I'm going to keep playing this trombone solo until, we get it right. So know your ABCs and keep this in mind. And I know this is just one more thing to keep in our heads as educators, but it will help you to better determine why you're seeing behaviors and when you are going to see those behaviors. All right, so some behavioral strategies. It goes without saying, set clear expectations. Again, if you're going to, especially in rehearsals, be very clear with what you want to get out that day. Some of my favorite, I don't have a behavioral diagnosis, but some of my favorite rehearsals are when I have gotten rehearsal schedules ahead of time and I see that, hey, we're working on this piece and we're specifically going to look at the B section and we're going to truly work on balance today and intonation. That I have an expectation of what we're doing that day. And even myself, I'm able to keep in mind, okay, I need to make sure that my part today is ready and that's what we're working on. So have very clear expectations. And have also clear expectations in your classrooms. And that's going to bring us to our next point. Class rules. We all have them. We all need them. I'm not saying we don't need them. But one strategy that has worked exceedingly well for me, especially in my classrooms with students with EBD, emotional behavioral disorders, is actually having the students make the class rules. And you can do this very easily. You can pull up the classroom rules on the smartboard, or even having a poster per each period or per each class that specifically highlights, 3, no more than 5 class rules. Believe it or not, the rules that the students have come up with are rules that I would have come up with. I may have worded them differently, but the thing is, when the students are coming up with the rules, they have ownership of it. It's not just something that Miss Laurie wants them to do today. It's truly like, oh no, this is class period 5 rules. Like, this is what we decided that we're going to do. Like, we're not, we're going to be, quiet when the teacher's talking. We're going to be fingering along to our music when, the band director's working, or band or orchestra director's working with, a different group. In choir, we're going to be looking over our lyrics and trying to memorize our lyrics while the choir director is working with, another section. So have the students create the classroom rules. It takes a little bit of time, but it's well worth it. And then if a student is acting up, all you have to do is point over to the classroom rules and remind them, like, hey, y'all, these are your rules, not mine. And then the other thing is have a consistent classroom behavior system. The one I have on this slide on the right is a classroom slide that is a classroom behavior system that I utilized during my student teaching. My student teaching was in a general music class. And, we basically just had, every student had their own set of clothespins with their name on it. And if they just needed to be redirected, maybe they would be, told to move their clothespin down. For the most part, we never got further than, just basically reminding them to like get redirected. A lot of my students would be on yellow at the most, and if they were having a really bad day, it was red or it would be orange. And that would be just something I would talk to the student after class and be like, these are the choices you made. How can we make better choices in the future? And I also just want to leave, some of you are probably very familiar with this, but it's something that I truly take to heart, and I teach my students this every year when we go over behavioral diagnoses. Sometimes the students with the worst behaviors need you the most. So do know that as my loving mentor used to say, the BAD kids, sometimes they're the ones who just truly need to know that you do care about them. And they do want structure. They do want to be told when they're doing wrong, but know that if you can show them that you care, and you genuinely care about them, and you genuinely care about how they're doing, and if you can check in with them, before and after class, they're going to love you, and they're going to know that you care about them, and they're going to be more willing to listen and work with you. So yeah, your toughest behaviors, know that they need you the most. All right, Katie.
Okay, so let's kind of take a look at some just situations here. This is just a quick little video clip of a music therapist working with a child, and of course, I know that we're not music therapists today. We're talking to music educators, but I want you to watch this video and think in terms of if this student was in, let's say, he looks to me to be probably about middle school. So let's imagine he's in your band room, or maybe he's in your middle school choir a couple of times a week. What types of instructional and environmental adaptations could we put in place? And so, gosh, I was going to kind of do like a side-by-side view of one of the earlier slides of the adaptations in the music classroom. But I want us to just think about, as we're watching this, think about participation, think about instructional input, how you would provide instruction to him, and then kind of what that output would be. How would he respond to you? Also consider like difficulty, how we could accommodate for changes in how difficult a musical task might be in our class, and possibly like an alternate goal. So think about some of these adaptations as we watch it, and then we'll kind of go to another slide and take a look at some ways in which we could make help him be successful in our classroom. Nope. Well,
hey everyone, welcome back.
Was that right?
I included a DVD and music kit.
That was perfect.
And stop. Should we do some more? Yes. All right. Let's play with those shakers today. Let's play with those shakers today. Let's play with those shakers today. Let's all play today. Yes, I say. Yes. All right. Yes, I say yes. Yes, I say yes. I say. Yes. Have a look. There you go. Let's try it again. Yes. Yes. Twinkle, twinkle, little star, how I wonder what you are. Up above, world so high, like a diamond in the sky. Stop. Should we do more? Hold on, here you go, bud. You gotta look. Yes. All right. Twinkle, twinkle, grab on. Little star, how I wonder what you are. Up above, the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. How I wonder what you are and stop.
Okay. All right, we'll go to the next slide here and kind of take a look at some adaptations. So when we think about, we have the adaptations we can make to our instruction and curriculum, but then also to our environment. So when we think about participation, so if he's in your music classroom, he's probably going to need a significant amount of assistance, right? He wasn't really initiating a lot of music playing on his own. It really required that person to be right next to him. He wasn't really holding or grabbing the instruments. It's not clear if he's maybe hyper responsive to touch. He didn't seem to withdraw from it, but he almost seemed to be a little withdrawn and not really super interested in it. But yet he was still there. He was still in the moment. So participation, he might need a peer buddy. He's one that could probably be paired up with another student in the classroom, and I could see that interaction going pretty well. It might also be that the role that he has within that song that you're working on or in that music experience is a little bit more simplified. So you notice that the music therapist is really using a very grounding beat, playing a steady beat, no syncopation. So thinking about instrumentation wise, how can we make it to where he can participate in a way that's going to support him musically? The input. So providing opportunities for movement, I think would be really helpful for this student, providing more tactile stimulation to help him feel the music. He really seemed to have that support there to experience the music itself. As far as output, we noticed that he's non-speaking, right? And he was using really an app, how we were looking at earlier with our high-tech apps for AAC devices. So he was using a yes, no app essentially. So, maybe we could take maybe he has an iPad. I'm not sure what resources they would have, but using some type of AAC device to cue a musical sound, right? So if that's the way that he's communicating, instead of a lot of those apps, instead of it saying yes or no, it could have sounds attached to them or other pictures. So maybe he cues a musical sound. So we could adapt the way we change his output, because he did seem to have a little bit of, he was kind of having a little bit of hard time being intentional about which one he was trying to select. But it's something that you could have a peer buddy and work with together. Difficulty, reducing the amount of time he plays the sound. So if he's not having to produce that sound all the time, that's not as stimulating or needing as much attention as if we're just going to do the sound every now and again. So if he's paired with that peer buddy, okay, Brian, this is where you make that sound. Be ready. And it's just a couple of times in the song, we can work on that difficulty. We might also adapt the size. So we're thinking about size, focus on playing just when cued. So not constantly making sound, just when cued. We're kind of putting it in little bite-sized pieces. So an alternate goal. So, our Georgia standards, one might be improvise a melody to a specified 8-measure harmonic progression using various musical styles and techniques. I don't know that that's going to be appropriate for him. However, he could still be successful in this ensemble environment with some type of alternative goal. Student will play their instrument when cued by their peer or by their peer buddy for one full measure, right? So they're still part of that improvisation experience that you're working on in class, but the expectations are just a little different. So providing an alternate goal. It could be increasing the amount of support from others. Again, that peer buddy. We could also adapt the physical space for this guy, right? Reducing visual stimulation. He was, for a large part of the beginning, he was looking around all over the place, and that room did not have a lot in there, but I could imagine a full out band room, that's going to be very overstimulating. So that might be something you need to think about. Maybe he just, instead of facing all the band instruments or the lockers or everything, maybe he's closer to you so that really his field of view is predominantly you and this person that's next to him. And then adapting instruments. How can we do that for him? Using an AAC device to trigger a musical sound, or even use something like a Debano, because he wasn't holding instruments. He wasn't grasping them. And even the music therapist had to say, grab the instrument or something. So he's clearly not at that stage where he's going to be able to hold onto an instrument for a long period of time. So how can we adapt that instrument, even if it's a Debano that stays on the ground, that he doesn't have to actually hold, and that every now and then when it's time to reach out and play, he can do that. So just thinking about these adaptations, what are these different areas and how we can help him? All right, so next scenario.
All right, so full disclosure, this was not a student I worked with, but I had one of my friends and music education colleagues reach out to me. This was like her third year teaching, and she was teaching middle school band, and she had this student, not named Carl, but for the purpose of this, we're going to call him Carl. And this is what she called and told me. So Carl is a 6th grade trombone player with autism and Down syndrome. During band class, Carl appears to get overstimulated by the percussion section behind him, as well as his peers who like to explore, this is middle school, so all you middle school band directors, you know what I mean, the fart sounds that their instruments can make. Hello, tubas and trombones. I know you like to do these. When overstimulated, Carl will scream and throw the trombone on the floor so that he can cover his ears. The band director also notices that Carl needs additional time to learn the concepts being taught in class. So we have a couple of things here. So we automatically see we have 2 diagnoses. We know we have autism, and as Ms. Whipple has pointed out, we're clearly seeing some sensory needs here. We're seeing this overstimulation of Carl like covering his ears. And we're seeing the behavior of him dropping the trombone. And yes, we do not want that. That damages a trombone. It puts stents in. It can, it can hurt other people. However, that is a reaction to the overstimulation. So we can't get mad at Carl for throwing the trombone on the floor, because what Carl's doing is he's protecting his ears. And also just those surprising sounds. And then we're also seeing the intellectual disability with Down syndrome, in the sense that it's taking an additional time to learn concepts being taught in class. So let's see what adaptations we could make in the music classroom. So, some suggested adaptations. Do whatever we can. I know it's band. I'm a band kid. I love band, but it can be very noisy. So do what we can to decrease the auditory stimuli. So one could be basically changing the instrumental setup. If we can move trombones maybe over to the side of the ensemble where they're not in front of the percussion section, if that's how you're setting up your band, that might be a way just to kind of move the trombone section away from the percussion section when they're doing those loud hits. And it may be like the band director saying, listen, guys, your fart sounds can happen outside of class, but when you're entering the band room, so putting in some expectations into the classroom for that student. Going back to those noise canceling headphones, this is another great thing you can potentially do in band. And what we did suggest this for this student, and he was very successful. He even went on to do marching band in high school. But it really helped once we got those noise canceling headphones, so that he could still hear, he could still be involved, but it was less overwhelming and overstimulating for him when he wore those headphones. So music adaptations, if it's possible to work with a student before or after school to help with those concepts, the more repetition you can give that student, and even breaking it down into smaller bits can really help. And this could also be an opportunity for an older student, maybe an 8th grader, who is available before or after school to work with this student if you are busy, because I know y'all are busy. Y'all have bus duty and cafeteria duty and whatever else you have before and after school. So even having another student, kind of come in and help, or if you have a partnership with the high school band program, maybe have a high school student come in and work with the students after school, just to help with those additional concepts. So that way you can continue to teach the concepts in class for the other students. And then again, we can definitely go back to that peer support, having a student sit between 2 strong students that would be willing to support the student, redirect the student, help the student with those concepts. And the other thing is, this is why we have to take all these arranging classes as music educators, rewrite the music to make it simpler for Carl. So maybe if, the 8th note concept is just really difficult for him, maybe for the purpose of, this semester of band, we're just going to try to get him to read the quarter notes, and maybe he's not playing every beat in the measure, but he has a simpler part. And as we get up into higher level band and orchestra, obviously there's, first, second, and third parts. So, Carl could play a third trombone part. And then other general physical adaptations to think about. If you are in a space where you have practice rooms in your music classroom, it may be a great way to have Carl put together his instrument and warm up before class in a quiet practice room. away from the loud farting band sounds. Even if he could go into your band office and maybe warm up there or put his instrument together in there. And then, as the band director comes in and cuts off the band to get them ready for warm ups, that's when Carl can come out and sit down in his section and, be ready. And that way he's not hypersensitive to the sound. He's had time to just kind of transition into the classroom. And again, with those noise canceling headphones, he should be less overwhelmed by all the sounds within the band class. And there's a great resource here for you to check out, noise canceling headphones. This did work. So not saying that this would work in your classroom. I think that's the other thing, is just be very flexible. And we're going to get into some general things now. So, but yeah.
So adaptive instruments, I just kind of wanted to touch on this a little bit because, it's really, we don't have enough time to talk about all the ways in which we can try to help students be successful in the classroom. But when I had asked, I have a friend who taught sixth grade, middle school band for almost 20 years. And now she's over in third through fifth in a band setting and introducing them. I think maybe they're doing recorder in the third, but they're definitely doing, a lot of the actual wind instruments in fourth and fifth. I was like, so what? I was like, what issues have you had? Like, what's going on? And she said she'll just never forget this one student she had. I think the student must have had cerebral palsy. She didn't tell me exactly, but he basically had some physical disabilities that just made it really difficult for him to play the instruments in the same way that all the other kids did. And so it just got me thinking about, because, a lot of the work that I've done over the years have included students and adults with cerebral palsy in different ways that we can adapt. I mean, that's a lot of what we do as music therapists, is adapting, because a lot of the people we work with have different things that just make it to where they need different ways to play instruments. So there's a lot of things that we can think about, but five things that we can consider today as we're thinking about how we can adapt instruments, because it's a whole world. And then you can go down rabbit holes of really trying to think about all these different ways we can adapt instruments for a specific person. One of the first things is really thinking about that instrument's accessibility and then pairing it with the client's needs. So, does the client, we're in a classroom setting, does the student have intentional motor control? What kind of motor control do they have? I mean, we can very easily think about the surface areas of certain instruments, like, for example, for a drum. The smaller the surface area, the lot more coordination you have to have that motor planning there to get there. If we have a larger surface area, we're increasing the likelihood that they're going to actually hit that drum, so to speak. So thinking about that. Also thinking about what kind of flexibility that student has, how far they're able to reach, how far high out, and thinking about also just the make of the instrument. So that needs to be considered. We also need to consider, what use of extremities do they have? Do they have bilateral use? Do they have just one arm? What they are able to really successfully navigate, because that's going to really impact the different instruments, because some instruments you can play one-handed. Some instruments you're going to need two hands, and some instruments you can modify in ways to just play with one hand. This is important, so we can really think about how these instruments are accessed. And then we also need to consider, what is the physical strength of this student? Because a lot of instruments, the weight of them is different, right? A little shaker is very different than a trombone. So there's a whole gambit when we're talking about weight. So thinking about those clients' physical needs really need to be paired with some of the inherent qualities of an instrument, because maybe we don't have to adapt the instrument at all. Maybe it's just a more appropriate instrument selection for that student. But if we are thinking about things that we need to adapt, some common adaptations are instrument mounts. And so I have this as an example. This is a percussion mount. This actually comes from A Day's Work, which they are no longer manufacturing these instruments, but they're handcrafted. But this can actually be put on, I don't know if you can tell, but this little clamp comes apart. This can be put underneath essentially like a table, but you could also put this on a sometimes people who are in wheelchairs, they will have like a little surface area that attaches to the wheelchair that you could actually put this on. But this would allow someone who really just has very little use in motor control to put just a little bit of touch, and they're able to play the drum. You can mount all other types of instruments here. I just put a kabasa here for now because you could very easily kind of reach out and touch that. There's other ways, other mounts, but essentially this is a mount. It just makes it to where the student doesn't have to hold the instrument and can really essentially use one hand. We also have grip and mallet adaptations. And so I have a couple here that I can show you. These are again from a day's work, but because he's no longer in business, there are some links there for, I think it's to West Music. West Music is selling different mallets and mallet cuffs. This is a two-handed mallet. So there are some clients I've worked with who just don't have enough motor control with that one arm or one hand. They really need to be able to use two hands to be able to successfully hit the surface of a drum. This has more of a right angle. I've worked with some people with cerebral palsy whose muscles are so spastic and just tense that they are not able to move their arm, stretch it out in a way that allows them to use a traditional mallet. So using something like this could allow them to still hit the area that they need to. So a right angled mallet. And then Velcro again. We're sponsored by Velcro today. With several different kind of shakers that I've purchased over the years. Again, this is from a day's work, but this would allow a student to basically have this Velcro to them so they don't have to actually have that grip. But it offers different sounds. And I like these because the timbre is different. It sounds different, and they're age appropriate. They would be age appropriate for someone in middle school or high school, right? And then we have something like this. This is called a pick assist. So the guitar pick essentially goes in here, and then the client the student doesn't even have to hold this, and they can help you strum the guitar or strum the ukulele. Maybe they're paired with a peer buddy who's actually playing the instrument, and then they are doing the strumming. So some adaptations there. And then here's just a traditional kind of wooden mallet that a student wouldn't have to actually grip, but would allow them to still play. And you could take the Velcro off. Just having just the square and having a thicker stick can be a little bit easier for some of our students with some physical disabilities to be able to hold on to a little bit easier. And then also just remember, ORF instruments are adaptable. I mean, right? We can change the way that we can, what notes we're putting in there to make things successful for our students. When we were thinking about, yes.
One real other thing to go back to, like the mallet and mallet grips.
Yeah.
Don't underestimate the use of a pool noodle, y'all. Especially with summer sales. I have used pool noodles because they are cheap. And if they get destroyed, no big deal. But to even stick a mallet in a pool noodle, especially if a student just needs something larger to grip, you can easily put a mallet in that, and yeah. And then again, it's a pool noodle, so it's fine if it gets destroyed. We can get another pool noodle next year. So
That's
sorry.
right. That's right. And you get them when they're on sale after summer, right? When school starts back. That's a great idea. Thinking about sensory needs, because we've talked a lot about sensory needs today, just being awareness of that hyper or over responsivity with certain students. This is the tone of the instruments, thinking about, brighter versus mellower tones. And if they're sitting next to a student who is playing an instrument that is extremely bright, maybe you need to play some next to someone that is going to be playing a more mellower instrument, or that has at least a slower onset to the attack, so that it's not quite so jarring. You can also think about the natural sensory attributes of an instrument for sensory stimulation, just in general. There are certain instruments that are just inherently, have a lot more visual and tactile information. If you're interested in learning a little bit more about how to really analyze instruments, there's a really good resource here that's put together, I believe, by an OT, but it's a breakdown of really analyzing instruments by a lot of the different sensory qualities, so that you can really think about, okay, if I have a student who's over or under responsive to a certain stimulation, how is that experience going to shape them playing this instrument, so that you can identify an instrument that might really meet their sensory needs. I can't stress enough, number 4, considering technology resources. So utilizing tablets and computers with music making apps. So a lot of us are probably familiar with things like GarageBand, Soundtrap, other types of DAWs that we can use. You just have to be knowledgeable and knowing how to adapt the settings of that computer and of those tablets, because I have, many years ago when I started using iPads to try to do some things with individuals with cerebral palsy, if you hit stuff the right way on an iPad, all of a sudden you have home screens coming up and all kind of things, but you can go in and you can adjust those settings so that doesn't happen. Consider reusing typical AAC devices for creating musical output. So I showed y'all a picture earlier of that Super Talker. Here is a Super Talker that we purchased through the clinic here. This is really cool because you can change it. You'll notice this is a 4 grid that comes with 1, 2, 4, or 8, and you can change the settings and pre-record information. Right now, I have it set to a boom whacker sound, so the student could, if they're not able to hold a boom whacker and actually do the motor that the motor action that's needed to create a sound, you could have them activate this device. They could activate it either by touching it, which this one, or there's switch inputs in the back here. You could plug up a switch that's easier to touch and that they could actually activate in their chair. And then maybe there's somebody else who's actually holding this device for them. You could record other sounds. You have a little cabasa sound. You could have an entire scale with an 8 grid, right? You could also set this to cue a chord. And so maybe they activate the chord, or maybe they're activating the root of the chord. So going back to those arranging skills, what kind of sound can the student activate so that they can be a part of that music making experience? Also consider, there is something called the Makey Makey. They don't have a patent on this whole idea that the Makey Makey is essentially a circuit board, and when you connect it to a computer via your USB input, and it basically tells the computer, instead of playing an like when you hit the A note on your keyboard that would create an A note on your computer, it basically rewrites some of these commands so that essentially you can use all kind of objects to trigger sound. So I have a couple of different links here. The first one says, check out the Makey Makey. It explains how you can make music with bananas. I've brought this to class and have had my students, we've connected it to bananas and play Twinkle Twinkle with bananas. The video will actually show you how people can take this and dip pizza in different pizza sauces to activate sounds, but it's basically just creating triggers. It's closing a circuit to create a sound. The cool thing about it is that you can use it and put your triggers anywhere and make your triggers almost out of anything, as long as it conducts electricity. Recently, we had a student come back and present on her work as a music therapist at the Children's Healthcare of Atlanta, and she works in several of the intensive care units. And she has brought the Makey Makey, and they often use Play-Doh, and they can put the Play-Doh in different places so that pediatric patients who are, recovering from surgery and really don't have a lot of ability to move can activate sounds and make music in really fun ways. So there's a lot of applications for it because you can individualize it for any student that you have. The other link is just a video of a musician presenting at a conference, talking about his experience of making music with the Makey Makey, and we paired it with really 2 different pieces of software, MIDI and Cakewalk. I'm not as proficient with that. The music therapist that he works with has kind of set that up, but there are different websites that you can visit that do go along with Makey Makey. If you go to their website, there's different music making websites that will do that software and make it to where you can very easily begin creating some musical sounds without having to learn how to use MIDI and Cakewalk and some of these other extensive dolls. So that's really fun. If you're interested in learning more about it, reach out to me. I can also try to get you in touch with another music therapist who uses this a lot with that musician with CP. The last considerations, number 5, that I wanted to briefly mention is always making sure that instruments are age appropriate. If you have a student who's in the high school setting, or you're teaching in the high school, just because they're maybe need a lot more support and have a lot higher need, doesn't necessarily mean that we need to give them instruments that are more for a younger child. We need to think about how to still provide age appropriate music making experiences, always cleaning our instruments properly, and considering ways that we can incorporate percussion. There's a lot of accessible percussion instruments available that we can use. I also suggest that you consult the experts. So Dr. Holmes Davis is an expert in adaptive instruments, and she has a really excellent webpage called More Able Than This that's part of a LibGuide here at Georgia College. I would also invite you to check that out, because there's a lot of great information there about a lot of the different unique instruments that can be created. And then there's another one about just different motor uses for cabasas and instruments. So the last little thing that we wanted to I guess, just bring to your attention today is because we kind of put a lot of information out there, can be overwhelming, and, take with it what you will. But there are a couple of things that we just sort of want to hit on to kind of wrap up today. So just general strategies, as in all teaching, creating a variety of learning modalities, thinking about how we're providing different auditory experiences, but also visual, kinesthetic learning, making sure that we're really thinking about that. I think a big piece of advice is never underestimate what a student's intelligence or ability is. They're constantly growing. We are working with children in a school setting. And just because they weren't able to do something in their 6th grade band class doesn't mean that when they move into 8th grade that they're not still able, that they haven't grown in those areas. Our kids are constantly developing. Making sure that the lessons that we're providing in our music classroom are age appropriate. And so that's really just comes back to the music, but also considering their abilities, being flexible. Something doesn't work, try something else. We are humans. There's no set prescriptions for making students 100% successful. So if something doesn't work, we try something else. Number 5 is really important, establishing rapport with students. And so, Dr. Peebles has mentioned you're working with a sea of maybe 50 students. This might be hard, right? But anytime you can kind of get to know them, their needs, their abilities, and pay attention to those students who might just need a little more assistance. Number 6, providing consistency and predictability. So consistency with the roles, instrumentation, and or the music. So keeping things the same as much as possible within that setting for our students who need a little more support can really help make things a little more successful for them. We definitely want to encourage that peer-to-peer interaction when it's appropriate, and really think about how we can use those peers in the classroom, because not only is it beneficial for that student who needs support, it's a really good learning experience for that student who's also helping them. Always thinking about how we can adapt our instruments and parts, and also the notation. We haven't really talked about notation or adapted notation very much today, but adapting the notation might just be an easy type of accommodation that you can make for a student. Maybe it just needs to be adapted. Maybe they need the letter names. Maybe they need it to be color coded. There might be ways that we can assist with that. Number 9 is repetition. Processing can be difficult for some students, so allowing time for that material and the experience to be processed, and that can help not just them, but all students, because we know that most students need to hear things at least 3 times to remember something. And number 10, meeting sensory needs and allowing time for that exploration. So just being aware of those sensory needs and trying to meet them, and maybe they just need to explore that instrument for a little bit and get used to that. So now what? Can a music therapist help you? There's a lot of different ways that we could help. If you're still having, trouble in your classroom with really trying to create a successful music experience and environment for students, you could have a music therapist come in and consult with you. You could reach out to us, tell us what the situation is. We could try to provide some strategies and solutions for you. You could also advocate to have a music therapist in your school district by providing direct services. So like I mentioned earlier, I started the music therapy program out at Milledgeville and Baldwin County school system. So we've got 6 to 7 different classrooms that we serve right now. We grow, we continue to grow because the students benefit from it so much. Maybe it's a situation where the student is just not appropriate for an inclusive music classroom. It's just not going to be beneficial for them. And maybe they do need more direct services. And then, of course, you could invite music therapists to come in and speak to your schools or to your fine arts department to kind of just give everybody some understandings of strategies that could be used within that school system. So there's a lot of different things that we could try to help you with as you move forward. Resources.
We have resources for you.
We have resources.
To check these out, and we can also put you in touch with more resources if needed.
Yes.
And please feel free to contact us and let us know if you have any additional questions. And thank you guys so much for checking us out and watching this video.
Thank you guys. Bye.